Hey everyone, it's Austin. When performing a bodyweight squat, one of the most important steps is ensuring that the patient is in the correct stance throughout the exercise. This will help to prevent any muscle imbalances through the movement, as well as helping to keep the patient's line of gravity well within their base of support to maintain stability throughout the movement. The patient's feet should be shoulder-width apart or slightly wider, with the toes either facing forward or with a slight external rotation based on what feels the most stable for the patient. Throughout the movement, the patient should maintain a straight back with a slight anterior lean. This will help ensure that their center of mass as well as the line of gravity fall within the midfoot area to ensure optimal stability for the entirety of the movement.
This is Bethany Morton looking at the osteokinematics. At the hip, knee, and ankle, the main motions happen in the sagittal plane around a coronal axis. These motions go anterior and posterior. As you can see, while he's doing the squat, the hip flexes, the knee flexes, and the ankle dorsiflexes. These motions happen in the sagittal plane, so moving anterior and posterior within that plane. On the descent of the squat, there is extension of the hip, extension of the knee, and plantar flexion of the ankle. Screw hole mechanism means that the femur internally rotates on full extension the last 30 degrees and externally rotates in the first 30 degrees of flexion in the transverse plane around a vertical axis.
Hey guys, this is Jacob Charlton, and I'm going to be talking about the orthokinematics that occurs in a squat. So this is a closed chain movement. So in a squat, in the descending phase of a squat, the tibial-femoral joint posteriorly rolls and anteriorly glides in knee flexion. In the ascending phase of a squat, the tibial-femoral joint anteriorly rolls and posteriorly glides in knee extension. In regards to the patellofemoral joint, in the descending phase, the patellofemoral joint glides inferiorly and slightly medial. In the ascending phase, the patella and the patellofemoral joint glides and tracks superiorly and slightly lateral. So that's what's going on.
This is Quinten. I'll be discussing the muscles associated with the hip and their involvement during the squat movement. The following 9 muscles all assist in hip flexion or the descending phase of a squat as they cross the anterior part of the hip joint. These include the iliopsoas, sartorius, TFL, rectus femoris, and the adductor muscles. These include pectineus, adductor brevis, adductor longus, adductor magnus, and the gracilis. The following 5 muscles all assist in hip extension during the ascending phase of a squat. These include the gluteus maximus and medius, as well as the 2 joint hamstring muscle groups, the semitendinosus and semimembranosus, as well as the biceps femoris long head. As the hip flexes during the descent of the squat, the rectus femoris and iliopsoas, as well as the accompanying hip flexor muscles, will contract eccentrically. During this descent phase, the glutes and hamstrings will eccentrically contract as well and act as synergists to the flexors in order to control the rate of hip flexion. Now, as we begin to ascend from the bottom of the squat, the hip extensors will contract concentrically, while the hip flexors act as antagonists and eccentrically contract.
Hi, my name is Mikayla Riar. I will be explaining what the muscles are doing at the knee joint during a closed chain squat. To start, we'll talk about the descending portion. As you're lowering your body, your knee is flexing, the hamstrings are concentrically contracting, the quadriceps are eccentrically contracting. Since there are some muscles that across the knee joint, they will also be involved. The synergists include popliteus, sartorius, gastroc, and gracilis. During the ascending portion, on the way back up, your knee is extending, the quadriceps are concentrically contracting, the hamstrings are eccentrically contracting, and in each of these, the concentrically contracting muscles are the agonist muscles. The eccentrically contracting muscles are the antagonist muscles.
Hello everyone, my name is Alvin Cherian. Today we'll be looking at the tibio-crural joint during a normal bodyweight squat. During descending phase, the action at the joint will be dorsiflexion, and the agonist for this action will be tibialis anterior, and the synergist will be the extensor digitorum longus, extensor hallucis longus, and the peroneus tertius, which all have to concentrically contract. The antagonist for this action will be the gastrocnemius and the soleus, which eccentrically contracts. During ascension at the joint, we see plantar flexion, and agonist for this motion is gastrocnemius, which concentrically contracts, as well as the synergist being the soleus, which also concentrically contracts. The antagonist for this motion is tibialis anterior, which has to eccentrically contract for full range of motion. Thank you for listening, and we hope you enjoyed our presentation.